The fields of medicine and healthcare are challenging on several levels. Many years of hard work and sacrifice are required for any practitioner to achieve even a nominal level of recognition. Many doctors are satisfied with just building a decent practice, and for good reason. However, there are some doctors who rise well above what is required of them. Doctors who want to expand and explore the field of medicine and challenge the outdated standards of who is qualified to work in the field of medicine. One such individual is Dr. Yele Aluko, who has risen from humble medical student to one of the most widely respected foremost authorities in adult cardiovascular medicine in the southeastern United States.
Cardiovascular medicine obviously is a very important disease process that claims the lives of several Americans and several individuals across the world.
A graduate of the University of Ibadan Medical School in Nigeria, West Africa, Dr. Aluko completed a residency in internal medicine in the United States and a fellowship in cardiovascular medicine at the College of Physicians and Surgeons at Columbia University in New York City, as well as the Cornell University Medical Center in New York and the University of Massachusetts Medical Center.
And it was during that training in internal medicine that I got to be interested in cardiovascular medicine.
Aluko has managed to manage that schedule in a way that allows him to pursue the community objectives that he thinks are important.
He entered private practice locally in 1989 and is currently a partner at Carolina Cardiology.
Yele has an incredible caring commitment to healthcare.
Fielding a team of 43 cardiologists, MCC's services reach out to 6 regional offices, 7 hospitals, and 4 counties.
You are helping humanity, and that is something that comes with serious responsibility that should not be taken lightly.
A former president of MCC, the practice experienced a rapid increase in market share under his stewardship and became the first specialty practice in North Carolina to implement an electronic medical record system to increase efficiency and maximize patient care. Dr. Aluko is also the director of the Cardiac Catheterization Laboratories at the Presbyterian Cardiovascular Institute, where he has exercised his exceptional clinical expertise to engage in several research studies, either as the lead investigator or co-partner. Dr. Aluko is a sought-after expert medical voice and willingly shares his knowledge and expert opinions frequently with local and national media.
I strongly believe that if one is blessed with achievement, that one has to be a mentor and a role model.
Dr. Aluko has always made it a priority to seek leadership positions in the healthcare associations and hospital systems in which he serves to help guide best practices and amplify the will toward civic responsibility and community involvement for these entities.
I have therefore, in my spare time, made a commitment to reach out to the community, to educate the community about several things that are of interest to me, one of which, of course, is healthcare.
One such organization is the Carolinas Association for Community Health Equity, to which Dr. Aluko is a founding member. This organization's prime mission is to spread education and advocate equality in the healthcare system through programs like the annual Mecklenburg County Health Symposium, which analyzes and addresses the issues that affect racial and ethnic minorities in healthcare across the United States.
There is evident healthcare available for all, but yet is not accessed by many.
Dr. Aluko is married to Dr. Shirley Houston Aluko from Beaufort, South Carolina. They have one daughter, Kike Chelsea, who was a member of the 2009 graduation class at Stanford University in Palo Alto, California. He is also a minority owner of the Charlotte Bobcats.
And I think it is important for minority aspirants, students, and otherwise to see African American images that are positive.
A tireless medical professional who constantly seeks ways of improving cardiovascular treatment and methodology, Dr. Aluko has always been an influential advocate for raising the awareness of healthcare disparities amongst the racial, ethnic, and gender minorities in the U.S.
To see that it is possible for such a person to navigate through the terrains of the turbulence in the climate around us.
As a medical student from Africa, Dr. Aluko entered the field of cardiovascular surgery at a time when it was almost unheard of for a black man to take this difficult road. And not only did he succeed, he thrived, helping to pave the way for other minorities to pursue a career in medicine.
Black physicians were not accepted in mainstream medicine in Mecklenburg County, were considered on the fringe.
He took all of those challenges, not only surpassed them, okay, but then, like you said, opened the door for a number of us.
His continuing commitment to advocating equality for patient and peer alike makes Dr. Yele Aluko a true luminary, a shining example of perseverance, selflessness, and an example to his colleagues that sometimes being a doctor is more than just treating patients.
He's a real example of what the determination of one person can lead to. The fact that he has achieved what he has in his medical practice means that he's got nurses and other people, assistants working who otherwise wouldn't be working. Think about that.
Thank you, Dr. Aluko, for teaching us that service is the rent we pay for living.
I have developed a commitment to, whenever possible, be a visible role model to all minorities, not just African Americans.